All right. Well, hi, hello, and welcome to Connecting Clouds, Rackspace Technology and Dell Technologies Simplify Healthcare. Now, today's exciting webinar is sponsored by Rackspace, featuring a guest speaker from Dell Technologies, which is pretty exciting, and of course, produced by Actual Tech Media. So between Rackspace and Dell, that is a whole lot of awesome here in one place. And I hope you guys are all as excited to jump in as I am. If I have not met you before, my name is Jess Steinbach with Actual Tech Media. Now, I know that this is going to be a fun conversation today because I really like these deep dives into healthcare tech in particular. The reason I do is because not only is this an evolving space that requires that constant and iterative innovation, it is something that affects all of us, that impacts all of us, whether we are in the healthcare industry, as most of you in the audience today will be, or making use of it, as we all will at some point or another. Now, today, our expert speakers from Rackspace and from Dell Technologies are going to walk us through some of those very specific risks and challenges that are in the healthcare IT space right now. And then, best of all, we will explore some of the solutions and the opportunities, both that are available now and that are on the horizon line. So this is going to be a really interesting day. And I do not want to take any time away from our speakers. So I will zip through a few of the important housekeeping points, and then I will get us on our way here. All right, well, very first, to start us out, I want to draw your attention on over to the questions section of your webinar console. Now, this is the absolute best place to get involved, to get interactive, and to post all of those insightful questions, comments, any feedback, ideas, whatever is on your mind, we want to hear from you. So all of that is happening in that questions window on your audience console. So find that tab and we'll give it a test run right now. Say hi, say hello, give a wave to the Actual Tech Media community that is out here with us today. Now, a quick side note, that window is also the best place to reach out and let us know if you do have any technical issues during our session. Knock on wood, of course, that won't come up, but if it does, you can let us know in that window there. Now, don't forget that a browser refresh is going to get rid of any of the usual tech gremlins, but if they are clinging on a little tight today, just shoot us a message in that questions tab and the Actual Tech Media crew will be there to help you out. All right, now the last thing I want to point out on this guided tour of your audience console is the handouts tab. Please do go check out some of those resources and follow-ups to our session here today. Now, definitely start exploring the Rackspace website. There are so many great links, support options, resources, demos, just about anything you could want, all there waiting for you. So be sure you click on that link, open that tab, save that for later because you're going to want to jump into that after we wrap up our webinar today. All right, now it is not just awesome content we are giving away here. We also have a $250 Amazon gift card as a prize drawing at the end of our webinar, so stay tuned for that. Now, I'll remind you that you do need to be here live in attendance during this webinar in order to qualify for the prize, and all winners must meet the Actual Tech Media prize terms and conditions. If you are not sure what those terms and conditions are, that's fine. I don't expect you to have those memorized. I certainly don't, but they are waiting for you there in that handouts tab. So just click into the handouts tab and you will find the T's and C's, the terms and conditions linked for you right there. All right. Well, I was mentioning that questions window a little bit earlier, and not only does asking a question today help guide the speakers along, it kind of brings up the energy of the entire webinar. It is also a great chance to win a prize. So today we're offering a $50 Amazon gift card to the best question asked. Now we're going to review all the questions asked after we wrap. So even if your question does not get asked live, there is still a chance to win. And I can tell you, our speakers are actually joining us today live from HIMSS. They're stepping away from their booths to come and talk to us. So they've left the conference to come and talk to us today. So we won't have as much time to dig into questions as we would like. And that means we're going to do some questions in follow-up over live chat and email. So when you're asking those questions, we will make sure that we get to as many as we can in our live session, and the rest we will follow up via email. So keep those questions coming in. It's going to bring up the whole energy of our discussion today, and you're then entered to win that $50 Amazon gift card. All right. Well, I think that's enough of the intro info. It's probably time to jump into it. We've got our speakers here waiting with us, so let's get them out here. I am so excited to introduce you all to Sanford Coker, VP of Product Healthcare at Rackspace, and Michael Fredericks, Apex and Multi-Cloud Healthcare Specialist at Dell Technologies. This is such a cool partnership, and as I said, a really fascinating topic. So I know we're all pretty pumped up to jump in. So why don't we get our speakers on out here with us? Give me one moment. Let's get our cameras rolling. All right. Well, Sam, Michael, thank you guys so much for being here with us today. I am very excited to dive in. Can you guys give us a little bit of the 101, introduce yourselves, and what are we going to dig into today?
Yeah, sure. Well, I'll go first, if that's okay, Sam. First of all, Sam and I have known each other for a long time. So, hey, it's really great to be able to be on this call with you. Thank you for inviting me. So, Mike Fredericks, I'm based outside of the Boston, Mass area, work for Dell Technologies. Have spent, I don't know, 15-ish 20 years in healthcare IT in one fashion or another, maybe a little bit more, and really excited today to talk with you, Sam, about, kind of collaborate on some of the challenges we're hearing from our
Mhm.
customers. And I think how what we do together can help them. I don't know, what's your take on it, Sam?
Yeah, no, Jess and Michael, thanks for having me. And one of the coolest things about healthcare, it's a small little world we work in, and we all know each other, and we all. It's amazing the number of people we run across to each other, and in a lot of ways, like we're here at HIMSS. A lot of this is just meeting people we haven't seen since the last Tim's.
Mm.
So like Michael and him and I have similar backgrounds. We both started out on the hospital side of the world. We've run operations. Then we moved over into different roles within whereas like I am now is I'm building out our healthcare practice completely around how do we move hospitals safely to the cloud, and how do we help them do the job of taking care of people. So
Well, I love that, and I think it's a really cool comment on the small town
Mm.
aspect of the healthcare industry and healthcare IT, and especially, I mean, talk about purpose driven profit, right? And you guys are all sharing that connection to this sort of bigger thing that you're working towards, and that health and well being element of it. So I think that is a really exciting aspect of the industry. And I am really pumped to kind of dig in a little bit more today because I think there are some really unique opportunities and challenges for the healthcare industry. And of course, in the last couple of years, a lot of those have come under the spotlight. So I want to start with some of those challenges as we dive in here. So, what are the biggest challenges? What are you hearing from customers right now?
Yeah.
Michael, let's start with
Yeah,
you.
thank you. So, healthcare, as Sam said, it's a small world. It's a really personal world too. And I think that that's one thing that is so unique about it. Now, I'm sure every career has, something similar, but I remember when I got my job with my healthcare system, I got my little ID badge, and wow, I just felt so cool to be contributing to what was going on in the community. It's so personal, and at the end of the day, so stressful, right? When we think about, you're like, well, I'm just in IT. I just connect the servers in the rack, or I just answer the phone calls, right? But in reality, part of what you do is affecting a patient live somewhere. First of all, it's affecting a clinician's live somewhere, and then it's affecting a patient's live somewhere. And even if it's not a clinician, right? It's a scheduler, it's a technician of some sort. It's anything that's interacting that patient's journey along the way. So, boy, I was so proud to be part of that. So when I talk with customers today and I'm hearing the challenges that they're going through, it's a bit heartbreaking, right? And I think that I'm glad to be able to be in this role at Dell and partnering with Rackspace and folks like Sam to figure out how can we do a little part at making that easier at the end of the day for the IT operations folks, which then impact the techs, which impact the clinicians, which impact the patients. Because at the end of the day, we're going to be in that hospital at some point and receiving those services, or our family members are. And we want to know that we've done, even though we don't have direct responsibility necessarily, making sure that we're doing what we can to impact that. So when I hear things like, I mean, CapEx and OpEx challenges have been right? The whole history that I've been in healthcare IT, it's been a thing. And I find that it's flipping back and forth faster than ever. I'll talk to the same healthcare organization 6 months apart, and they will have completely pivoted on whether they need to work in a capex fashion or an opex fashion today based on X. And certainly we're seeing the staffing shortages, and we're seeing the headlines are from a clinical standpoint, right? And I think Sam's got some good information on this as well. But I was reading some news articles yesterday. I think it was 800,000 nurses that are expected to leave the workforce by 2027, and then that translates down to the IT workers as well. There's a staffing shortage of qualified individuals to help in these environments. So helping provide technologies and services that can make that staffing shortage problem a bit easier is part of what we want to be part of. Negative margins and like closures, Sam, I don't know, this is just, maybe it seems new to me, it seems different. When I look at the news lately, I'm seeing more reports of hospital closures and closing down departments or services or even entire hospitals than I can ever remember. It's a little bit kind of shaking, really, to see that. And staff burnout and security, right? And security contributes to staff burnout. And Sam, I know you see this a lot on your side as well, but uh, one study showing 344, I think, breaches in healthcare, according to the article I read in 2022, in US healthcare in 2022. And on average, 1,400 cyber attacks hitting healthcare worldwide every week. Not necessarily breaches, but those attacks, right? And that's what leads to some of that burnout, right? How do I keep up with that? Keep my staff motivated, give them the tools that they need to defend and to recharge a little bit. So, and certainly, data growth, right? I don't know, Sam. What do you see in relation to that?
Yeah, no, I'm going to agree with that. I mean, you've got these outside pressures pushing in, from nursing shortages to just clinician burnout to then you know, you and I've been in IT technology a long time, and some of the problems comes with the burnout that we're requiring clinicians to click on messages over and over
Mhm.
again. Like, you think about when you go to the doctor's office, how much time your physician sets looking and entering
Mm.
in on a keyboard screen instead of interacting with you as
And
a
it's like,
patient.
hello, I'm here. Hello, I'm right here.
Yeah, and that's in some ways technology helps. Technology's come in and helped us, but it's also in a way technology has actually stepped in between sometimes between the clinician interacting with the patient, and the patient's the core of what we do. And then you're spot on. We've got these outside pressures that aren't IT focused, but they definitely hit the revenue, and a hospital is going to spend money on their clinicians and keeping the clinicians and the patients healthy. And if they have to cut things, it's going to be IT that gets cut. Then, listen, ransomware is a very scary thing, and we are a vector of attack because we will pay, and we have to pay because it's time. Our information is timely, and if you've got your wife, your mother, your friend on that table, and you've got a ransomware attack, and the screens are locked up, the clinicians will still do the work, but there is so much stuff there that is just blocking the way. And so those are the negative things, and that's the scary things. And I don't mean to imply that there's no hope, because a lot of what we've got to do is look at how do we improve patient care, because hospitals are changing. The goal is to try to, if we go back to look how disease was, the goal now is to keep people out of hospitals. Whereas in the past, you had a heart attack, you went in, paid the bill, got done. Whereas now we've transitioned to sort of lifestyle diseases, where if you have high blood pressure or diabetes or whatever, we treat early and we intervene early, and then we can get you to change your lifestyle. That helps you. That helps keep you out of the hospital, but it sure doesn't understand how a hospital gets paid for what they need to do. And then, how do we do more with less? How do we bring care to our patients and personalize that care in a way that they can respond? And, IT is not going to solve all this, but IT has a part of it, and technology has a part of it. And even such strange things as there's two examples of where I see that technology has had an impact. One's the use of voice in the home. I mean, if you think about, like, if you know, I don't remember sometimes to take the medicines I'm supposed to take, or I don't remember to order my prescriptions when I'm supposed to, or to go get them picked up. But if when I'm in the bathroom in the morning and I see I'm the last one, I say, "Hey, whatever, you know, order my prescriptions." That's amazing, because then that actually helps reduce, you not taking your drugs properly, all the way to devices, all this plethora of devices that we have now that that are just truly amazing. I mean, we can't use them as a pure medical device because they're not FDA approved, they're not diagnostic. But if you think of like your smartwatch, you have an EKG on there, you have an oxygen meter, you have a blood pressure, or you can have blood pressure, but you also have a heartbeat monitor. And if we can tie that in back to your record, so let's say we see an anomaly in your EKG and we send an alert back to your clinician, and your clinician say, "Oh, that's an anomaly. Maybe we need to get a real EKG, a real medically approved device on you." That's ways technology can change healthcare. So there's challenges, yeah, but I also think there's bright, hopeful opportunity too. So
Yeah, that's a good point. There's some scary parts of it, but also the good news is the bad news is we have a lot of technology. Good news is we have a lot of technology, right?
yeah.
And it's about picking the right things for the right places. And there's no silver bullet. It's not like a healthcare system can do these two things and everything's going to be solved for them, right? But strategically, whether it's on the clinical side or on the operations side, making strategic decisions and strategic plans, and just sticking those through and implementing them, can really pay dividends in the long term. So good time.
I'm so glad you guys you started out so negatively, and then we got so positive at the end, and it's been a roller coaster already, and we're just getting started. I have to say, Michael, it's weird, but you actually kind of gave me goosebumps a little bit when you said everyone's going to end up in the hospital, or family members, or not end up in the hospital, but end up experiencing this care, and it was such a simple thing, because I thought, well, yeah, obviously, but I think we forget that sometimes. It's so easy for it to be not in my yard, if you're not currently experiencing healthcare, coverage, or interacting with it on a daily basis. And I want to thank you for that reminder, because this is very much, well, everyone in this audience is in this industry anyway, so it is in your yard, regardless. But I think on a human level, that's a really good remander. And I am excited about the technology as the solution and the scary problem. And I do want to ask you to dig in a little bit more detail about some of those solutions, and kind of bring some of that to the audience. But before we do that, I'm wondering if we can take a look at cloud, because that's on a lot of people's minds right now. And I think there's some fears around. It's very similar to where we were just at. There's some fears and some concerns, and there's also a lot of opportunities. And I'm wondering if you can kind of talk to us about where cloud is sitting in healthcare right now, and what customers in the healthcare industry are talking to you about their experience with cloud, their concerns, et cetera.
Yeah. Yeah, great. I'll start off with that if that's okay. I think having been in this business for a while, really having been working in IT operations at the advent of the public cloud, I think, and now looking at where we are now, it's been interesting to kind of see how it's changed over time. And I know, Sam, you've been deeply involved in this community. And I think from my perspective, back working in the healthcare system at the time that the hyperscalers started coming along, there was this mindset of, I think first of like, oh no, we can't move any of our stuff to the cloud. Like it's not safe enough, it's not reliable enough, so forth. And then people kind of did a complete 180 on that and said, we've picked this cloud provider and we're moving everything to it. That's it. You talk to them, we're going all in here. And I think, we've seen those temper over the years to where we are now. To where we are now is realizing that the solutions that are available in the hyperscalers and the public clouds offer real value and real ingenuity. So it's about tapping into those services in the smartest way possible for the healthcare system, to do what they need to do with those services, but also to protect for what's next, because there's a great service over here today, and there's an even better one over here tomorrow. So how do we design how do we design our staff, first of all, to support that, our organizational model? That can be a dynamic shift for a lot of organizations. And I think Sam can probably comment on that a lot with his experience. But also, how do we make sure that from a technical standpoint that we're able to take advantage of those going forward? So when I talk to customers, again, that's what I hear. There's a lot of innovation in there. How do I tap into it in a smart way? At the same time, we see whole businesses, whole companies starting up for how do we control the costs in the cloud? Because it's easy to get in the cloud. It's very hard to get out of the cloud, and it's hard. It can be hard if you're not designing a good model to control your costs around that. So it's around cloud done right, or multi-cloud by design, as we typically talk about it with our customers. Some of the cool things that have happened is a lot of the hyperscalers and the cloud providers, they've been able to develop mindshare with these customers. They maybe have annual commitments with them, and they've figured out how to synergize some of the agreements that these customers have. So one of the questions we often get is, how do I need what's available over here for me in the cloud, but I also need to keep doing X, Y, and Z. How do I use my committed cloud spend to do these other things? And between the two of us here, we've got a lot of really cool ways that partners can capitalize on that committed spend to do enhanced things like cyber vaults and data protection that spans across clouds, and common storage platforms that span across clouds. I think but I think one thing to mention too is, and I should have started with this because I don't want to end on the negative, but cloud doesn't inherently get rid of the security problems that we're facing. There's a lot of great security things about cloud, but it doesn't get rid of our responsibility to protect those environments. And so having this cyber resilient framework and process in place is important regardless of where your workloads are today, where they'll be 5 years from now, and where they are in between. So I think that we have to keep that in mind as cloud doesn't necessarily solve a lot of the things that people maybe initially thought it solved, but it does give us a lot of great tools to take advantage of in our arsenal. So Sam, what do you think about that?
Yeah, no, I'm with you on that, and I think I want to kind of step back a little bit, because cloud's one of those words that we all hear a lot, but we all sometimes have a different definition of what it is. So I want to kind of lay a little ground guide rail so that when you hear cloud, as we continue this conversation, kind of like what we're talking about. In my experience, cloud is kind of we're going to find it three ways. We're going to see public cloud, and those you'll also hear the term maybe the hyperscalers. Those are the Azures, the AWS, and the GCPs of the world. These are the commodity cloud providers, and that's the public cloud that I think is a good one. And then you have another group, sort of the private cloud offering. That's where my company has to fit in as well. Is that these are we provide cloud-like services built upon known infrastructures, but also do things like are much more hyper local, maybe have different connections than the cloud providers do, maybe different locations. And then finally, you still have a large, especially in healthcare, on-prem's still a large piece of it. I mean, as you and I both know, we still have the ability to generate our own power. I mean, and we go through data center tests all the time where, I happen to be in New York during Sandy and working hospitals even until the hospital flooded, you could go plug in to any outlet and get electricity out of it, even though everything around us was dark. Mm-hmm. And that is something that we do. And I think the challenge then becomes, okay, where do we put the right thing at the right place to get value? And usually where I see the biggest decider, besides money and other things like that, and security and privacy, really comes around latency. Applications need to talk to each other, and how quickly they talk about, and where latency works, or where things need to be close together, or where things could be maybe farther apart. What we I have been very lucky in my careers. I've worked in all three of these, and I was when, and I think in my what I saw was that COVID was kind of the biggest accelerator of change I've seen in my career. And that was what we saw in the public cloud space was that when COVID hit and when we moved all of our staffs remotely, our hospitals weren't designed to do remote support of our workers. We'd all worked in the hospitals. We all came into the office every day, and everything was set up that way. So when they went to the when COVID hit and we all started working from home, um, that's where I saw a big increase in spend in public cloud because all of a sudden they needed the remote workforces, they needed all the tools they could do in the cloud, and then so all of a sudden all the hospital or a lot of hospitals moved huge amounts of resources to the cloud, to the public clouds. The biggest challenge though with public cloud is cost containment. It really is. You have to be very religious about shutting things off to understand value of this. And it's not dissimilar like when we did the migration to VMware, we were told the same thing. We're going to save all this money and stuff. But the problem with VMware was we'd stand up VMs
Mm.
and then we'd never go back and shut them off. And then we'd wonder why we run out of resources and I'd have to go back to my CIO and says, "Oh, I need another $1.5 million to support my VMware environment," because we didn't set up rules to say that if you haven't touched this machine in 2 years, we should delete it. Okay, you can't get away with that in the public cloud. If you do that, your bills are going to go high. So one of the things we've seen is because you either don't know and I think you touched on this very well, Michael. It's listen, we're all professionals. We understand good architecture professionals, but working in the cloud is just a little different than working on prem. And you have different levers you pull, different dials you turn, and trying to learn how to do something new while you're trying to keep the hospital up and going during a during a pandemic. It's a lot to ask of people, and so what I am seeing now is reevaluation of where do I put the workload in the right place at the right time, and that could be like repatriation. We don't see I haven't seen a lot of repatriations back into on-prem data centers. Usually that leaves it goes, but then that's where I think companies like mine have come up, and that we've have a long history of working in private cloud and infrastructure offerings and data center offerings for a long time, but we're starting to see an uptick in, okay, well, this workload either for latency reasons, or the fact that you can't modernize this application, it doesn't effectively work in public cloud, and that we need to repatriate it down to here. And then like I said, you hit on it well. The cloud security in the cloud is very good, but it's still security. And I think of how I used to build things in data centers, and it was like a hard candy shell with a soft gooey center, like a Malamar or something like that. And that was how my security model was. And now you approach security both in your cloud and even in your on-prem. You should approach it like a hard candy, where there's layers of security in there, but they're hard layers all the way through. So, I yeah, you want to follow up with some of that,
No,
Michael?
I
Or
mean, I
you?
like that analogy. And I think I definitely started out with the traditional definition of cloud, right, and talked about the public cloud. But you were right to bring us back into focus there on the fact that, kind of supporting what we do best here at Dell Technologies. I mean, and I think the synergy between our two companies is great because you've got a company like Rackspace that is well skilled and qualified to host these private clouds, can do stuff, can bridge that gap to the public cloud. And so it's kind of like this constant stepping stone. So Dell Technologies, I feel makes the world's best selection of technology and infrastructure products and the software that drives that, right? And our goal is to make that available to customers in their on-prem data center when that makes sense for them. And a lot of customers do. I was just on the phone about an hour before this call with a CIO who pretty much has, they said, "I want to keep my stuff here. I like it here." And I was like, "Okay, great." But then you have a lot of those customers that say, I need to do something different because of X, Y, and Z, right? My facility is aging. I need to move more to an OpEx model, whatever that may be, where it makes sense to look at a private cloud type solution with Rackspace. And hey, what's the benefit there? We get to use the same great Dell technologies that they're used to. Not only is that a system in the process of getting there, but should they decide to include, public cloud, augmenting that with public cloud in the future, those same technologies could then extend out of the Rackspace private cloud into the public cloud, right? So, it's just a great synergy and ultimately giving customer choice and flexibility and their ability to continue to adapt. Because, like you said, if somebody truly exited the data center business at some point and went to cloud and then realized that they need to do something different because of whatever latency issues, cost reasons, whatever it may be, it's unlikely that they're going to build up a new data center again, right? So that landing zone of what Rackspace can provide, and oh, by the way, keeping them cloud adjacent. So they're back into that private cloud operating model, but they keep that flexibility with public cloud. So I think it's a great match and that great middle ground that a lot of customers are looking for.
Yeah, and I think it's one of the areas that we're truly trying to like innovate ahead of the curve, and try to meet where our customers are trying to go, meet where the hospitals are trying to go, and then leverage and move forward. So, and still deliver better care and not get 3 a.m. and hopefully decrease the number of 3 a.m. phone calls that you get. So
absolutely. Yep.
Yeah.
Well, everyone wants to reduce the 3 a.m. phone calls they're getting. That's a key deliverable from this. And I also want to thank you for adding a new good security analogy and metaphor to my list, because I've been using castles and moats and I've been using rainbows and onions, but I don't have a Malamar analogy. So this is great. New skill set. Thank you.
Sounds like it's going to a Jolly Rancher strategy now.
Yeah.
Yes. The Gobstopper and the Malamar. Yeah. All the old 90s candies. Michael, you actually did we're just kind of starting to steer us into where I wanted to go next. And so I'm going to dovetail on with you there. I think you guys did a great job of sort of level setting our why and what brings us to this conversation today, and what are, the concerns that we have in healthcare specifically and with cloud, and a little bit of what are the opportunities there as well. Both of you have mentioned a couple of times, picking the right solution for the right need. And I think that is really important. And what I want to ask you to do now is dig in a little bit into the solutions that you're bringing to us today. If we can talk about the Dell Alliance Healthcare Card, if we can also, and Sam, it occurs to me, for anyone out there, I'm sure there's a lot of raving Rackspace fans in the audience today, but for anyone that isn't as familiar. So I'm wondering if you guys can give us a little bit of that kind of, what is the right solution that you're bringing to us today?
Yeah, thank you so much, Jess. So I kind of led into this a little bit maybe in my last statement, but what we've done at Dell, and I talked about this partnership with Rackspace, and so we've created this naming of the Dell Alliance Healthcare Cloud. And I think what you need to know about that, it's how we partner with companies like Rackspace, who are uniquely qualified in both the traditional private cloud operations, but also have a layer of healthcare expertise to add on top of it. So when I go, because the folks that maybe just do IT operations without the healthcare background, that may be okay. In some spots, it depends how much of that responsibility the healthcare organization wants to own. But usually, healthcare organizations I talk to are looking to, if they're going to make a move, they want to make a move to somebody that they know can support them at a higher level. So we talk about the Dell Alliance Healthcare Cloud in the sense that we take, first of all, the team that I come from at Dell, we have a global healthcare team. We have over 100 individuals that call on our healthcare customers and partners across the world. And we have folks that we have former CNOs and CIOs and CTOs. We have people that still practice as clinicians that are on our healthcare team here at Dell. So really fortunate to be part of that. And folks that have worked with a lot of these healthcare ISVs that we talk about all the time, all the big EMR providers and imaging providers, and individuals that have either worked at those companies or worked in healthcare institutions that have those technologies. So our goal is to take that combination of presence in the industry, to take the market leadership position that Dell has in healthcare, the experience that our team has from healthcare operational and in some cases a clinician standpoint, and use that to design solutions that, in conjunction with Rackspace, that are well validated, well thought out, and provide a safe, landing spot for these customers that are looking to go to that next level. So, um, and again, part of that, what I mentioned in the previous talking spot was about how when we have the Dell technologies and the customers that are using these already to run mission critical workloads and to protect mission critical workloads, how do we extend that technology to, like Rackspace, to use similar technology so that they get the same levels of performance and reliability. And in some cases, they may have specific needs where they want to keep some on-premise environments, and they're going to use, Rackspace as a way to augment that. So having common platforms on-prem and in Rackspace and potentially in public cloud that they can use, the same data protection platforms, the same storage platforms. Um, these are the benefits of what I hope that we bring to the table in the partnership. And I don't know, Sam, if you had anything you wanted to add to that.
Yeah, no, and I think that's what I'm kind of most excited about with this, besides getting to work with a bunch of friends I've worked with for a long time, is that, healthcare's not necessarily hard. It's just complex. And, we really, and there's areas that we want to focus in where we build our strengths to. And then, like I said, we've made a decision to build our infrastructure on top best of breed technology. That's why we use Dell. That's why we built our environment around and on top of that. But conversely too, the teams that I'm filling out is we're approaching this as how do I supplement an IT department with the resources you need? The teams I have built out, all the way from me, who happen to, from my role, who leads this, all the way to the people that I have running the individual, my ECAs and my ODBMs that have EPIC certifications. They're all hospital people. They all come out of hospitals. That's the requirement we're looking for. I want people that understand what it's like to get that 3 a.m. phone call.
Mm.
And I think that is critical for us to sit here. And our goal in this is to be a supplement to these departments, to be a trusted advisor, to say, hey, we have the resources to say, maybe you should, in our experience, you should put this in this place and this in this place, or we know this application, this is how we do it. But also we want to free up resources on your side so that you can take those people, because you're shorter resources as well, and you can level them up to do what you need them to do, to work up higher level in that stack. And then my team, we push in with the shoulders and lift and help, create the LUNs, do the patching, keep the things in control, and work hand in hand with you and supplement you as your IT staff. And I think by approaching this model, by pulling in with the alliance with Dell, where you have on-prem that is mirrored on that, and then you can have the exact same hardware in the cloud, that removes complexity out of a complex system. And I think that's what we both strive for with this, and that's why it's very much a partnership, because there's things that we do well, and there's things that Dell does better, and so together we're better. So yeah.
And Sam, if I could add to that, I think the double clicking on the flexibility aspect that you talked about there, and that is that when we talk, I know with our healthcare customers, they're all at different stages, right? Some may not have, they may have such a staffing shortage area in their area that they have no choice. They have to go with a company that can provide these higher level services because they just can't get them. And then you've got other teams that have got a well-seasoned staff that aren't going anywhere. So that ability to say, where am I turning that dial with Rackspace on top of the managed infrastructure? What else do I need them to do that's healthcare and application related? I think, and whether I need it today or tomorrow, having that flexibility, I think, is a big selling point for us. It's not all or nothing. Do you want just disaster recovery today? Do you want production and DR tomorrow? Do you need to host, all these different applications, or just one, right? I mean, it's what do you need, right?
And as well as I do, it's a gradual thing. At the end of the day, we have to build trust, and we have to prove that we can do this. And the way you do this is you start by delivering results. So you take a little bit here and take that. But I always found, our customers know their environments really well, and some of the smartest people I've ever worked with come out of these environments. But I think one thing that people like you and I bring to this is that we get to talk to a lot of different institutions, and we see different ways of doing things, and not necessarily right ways of doing things or wrong ways of doing things, but just different things to do. And I think that's another kind of unsaid value that we bring that helps earn the trust and build the trust that we're really, it's easy to be there when everything's good. It's 3 a.m. in the morning and your PAX is down. That's when and you're not able to do, or you've got a ransomware event and you can't do intakes. That's when that's why you partner with people, and that's why you're there. So
I still get those like shakes every once in a while, thinking my pager's going off next to the bed,
yeah.
right? Something,
Yeah.
Is it raining? Is my data center leaking? What's going on?
Every time your phone rings, the panic rises.
I'm
It's
actually
that
only
3
22. This gray hair just comes from all the years.
Yeah, that's the witching hour for IT is those, late night call. Okay, well, guys, this has been absolutely fascinating, and I'm loving kind of digging in. I feel like you did just give us a really nice kind of through line back to where we started, especially with some of these things, removing that complexity, and really supporting teams, especially when we talk about burnout and staffing shortages. So those are really key benefits. I actually would love to pause here and take a few questions from our audience. If you guys have the time, and we can dig into that a little bit. Awesome. Okay. So I wanted to start with this one, and I think I'll kick it to Michael to start, and then Sam, if you have anything you want to add. Can you host more than just Epic in the Dell Alliance Healthcare Cloud?
Yeah, so good question. I think we talked about like flexibility being key there, right? And a lot of times, and Sam, you even mentioned it, a lot of times these conversations are starting with one key need, right? I need Epic hosted, I need this hosted. And then it's like, oh, but you can do other things, right? And so the answer is of course is yes. And I don't know, Sam, if you want to add on any more specifics to that.
Yeah, I mean, I kind of feel, especially for Rackspace, that was how we looked at this approach. Like, how do we differentiate ourselves in the market? And I remember when I worked on the hospital side and I was leading up the clinical systems, I had a map behind me of all the ins and out and all the connections a thing made, a message made passing through an Epic system. And, I think at the time at the hospital I was at, we had 4,200 applications that we were responsible for. And that was after a consolidation where we killed a bunch of them. And that's not unusual. I mean, we kind of laugh about it, but we go through that. So our goal on this is we look at this as a holistic model. How does a hospital safely run the cloud? And then how do we help that hospital do it? And that's the way we're approaching this. Full stack support, all the way from LIMS to ERPs. It just like, and I think it's important to understand, like I said earlier, the biggest problem I find when a person moves anything around is latency between systems. Does my Epic system talk to my ERP system properly so that when a nurse pulls supplies out of a cabinet, the order goes out? Okay, so that we can replace those supplies for Q-tips or something like that. All the way to like when you order your drugs with your pharmacy, when the doctor orders your prescription, that electronic e-prescription, e-prescribe gets sent and gets filed with the right pharmacy. Mm-hmm. And being able to kind of talk about that and understand it's not just this Epic and Meditech and Cerner, they're all important, but they're part of a larger ecosystem. And I think that's the real value. And just to plug Rackspace a little bit, I think that's a real value that we bring and something that we have focused on like a laser on this one. This is something that we're building our practice, and I feel we're unique in this space. So.
That actually ties in really well to another question that we got. And so, Sam, I'm going to leave it with you for a second, because we had someone who was asking here if you could dig in a little bit about what, it's a big industry and there's a lot of options out there. And as I said earlier, you guys have both mentioned, right tool for right, solution. So it's not necessarily better or worse. It's finding that right tool for you. So can you give us a little bit of that key unique, what differentiates Rackspace?
But besides what I said earlier, I think the other thing that helps is our connections to the public cloud providers. And I'm agnostic on those. I have direct connections to all those with discounts, and then I build my core data centers right next to the core nodes of the hyperscalers as well. So I have direct private low latency connections both in and out of the cloud providers, and that kind of puts us in a unique place because each of the cloud providers, like Azure or AWS or GCP, they each do something a little bit different and a little bit better. And then there's also a reason we did that when we bought different kinds of hardware. We always wanted to have a multi-vendor strategy, and there's a reason that I might want to do something in one cloud and something in another cloud, another public cloud. So the one area that we can help with there is providing those interconnects in and out at a reduced cost of egress fees, because we've negotiated these connections with the scalers that we can reduce your egress fee costs when you're trying to move between your Rackspace and, let's say, AWS, with a workload in there, to then take that output and put it to something in Azure. And I think that is also another differentiator. And then, like I said, the teams are made up of long-term healthcare people, you know.
Yeah, that's a big difference, having the key stakeholders involved in the discussion, in the conversation, and being a part of that. I'm going to throw another question at you here, because we do have an audience that has a wide range of size when it comes to the organization. So question, how big of an Epic customer can you support?
Michael, how big of an Epic customer can Dell support?
Dell can support any size Epic customer, and in fact, a large percentage of I think it was, if I'm not mistaken, don't quote me, somewhere about 8 out of the top 10 Epic customers in terms of size run their databases, in particular on Dell storage, to get that performance and reliability. So, Sam, how big of an Epic customer can you support?
As big as you want, and that's I think that's a key, and that's a value, like we talked earlier about, like, how do we differentiate ourselves now? So we can run any official size on-prem Epic customer. We can do that. We build on standard Dell hardware with standard Dell arrays. We're covered there. But because of these low latency connections and these short distance between them, you could, and we have done this before, you can run part of your Epic workload in the cloud, part of it, and then have the core Iris database reside inside us. The reporting databases reside in us, because neither of the cloud providers could scale to that size. Or you can run it completely into us, or you can use a mix and match between your on-prem and have us as your secondary or your DR leg, or your alternate site. The key with that one is, this is another advantage we have because of where we're at. Like, we also have data centers in places that the cloud providers aren't. So we've got really good coverage in the Houston, Dallas region, all the way up into Kansas City, into the Intermountain region, that a lot of the hyperscalers don't have. Once again, latency issues. Like I said, I hate to come back to that, but 90% of my technical problems have to do with latency. So,
yeah, I think to the point there, right? It's flexibility, and it's about options. And you laid out a number of options there, Sam. And to some, they may say, they may think, well, that just sounds too confusing. I'm just going to move it all here or whatever, right? And the goal at the end of the day is what do you need to do? What's the business metrics behind there? What are the technical metrics to get there? And let us help you see the options that are available, because it may not be just what you think, again. And I think that points to what you were saying.
I love that. And that is a form of cost management that is often forgotten, is just making sure that you're only using what you need, and that you're getting the most out of what you have. Which actually brings us to cost. And I had a question here that I want to ask you guys, is, about billing and kind of digging into that a little bit more. So can you give a little insight into the types of billing for these?
Yeah. So once again, I'm flexible. So generally, the way we approach this is we're looking at monthly recurring revenue. So you would build on a per solution basis. But because of our unique relationship with Dell and the ability that we do this with other companies, we've also have the ability to do things like, to do just about any kind of method and model you can think of, including financing the Dell equipment for you, to you want to do a very traditional colo where you want to put the equipment in. And then, but all the way up to the point of like on-demand usage base with the ability to scale when you need, built upon VMware and Dell hardware. So we have a model that we call SDDC Flex, where you want, it's a very cloud-like model built upon VMware on Dell servers using Dell storage technology, where you literally rent VMs from us. You say, I need a 2 vCPU or 4 vCPU. I need this much memory. I need this much storage. You get a monthly bill for it. And then when you're done and you shut it off, you can shut it off. So we, once again, and I think this is the general theme in healthcare, one size doesn't fit all. And we're complex environments, and complex environments require flexible solutions. So.
And Sam, I think one thing I've seen, having worked with you and your team on a number of these conversations and opportunities in the past, is that, again, it's about trying to figure out what's the best way to get from A to Z. And sometimes that's, what existing licensing agreements do I already have in place? What type of monthly commitments do I already have in place with X, Y, and Z? Let's throw that all in the bucket and make that part of the formula to figure out what's the most cost-effective way that we jointly get you to a solution that meets your business and technical goals, right? And I think, yeah, it's great.
I love that. I'm hearing from you guys. Bring it on. If you need agility, if you need scalability, if you need flexibility, whatever it is, that's you guys are going to be there for that conversation and help people figure out what they need. I love that. The no one size fits all. I think that is a really important reminder. And guys, I have to say, I wish we could keep going because I have many more questions for you in our queue here. And I am going to make sure that those all get to the Rackspace team. So anyone who asks a question that we didn't get to in this live Q&A will get a follow-up via email. So stay tuned for those. But since you guys are at HIMSS, and I feel like we need to let you you're supposed to be at booths like right now. So we should probably let you go. Before you take off though, for someone who just got all amped up about all those options and wants to start that conversation with you about those exciting, scalable and agile and flexible options, what do they do as their first step to jumping in with
tomorrow night? Stop by the Dell booth at the end of the reception. We're hosting a reception with our friends at Dell. If you come a little earlier, myself and a couple other Rackspace people are going to kind of go in deeper about some of the things we've talked about today. But once again, refreshments and conversation, and love to meet you. And then also at the end of this, I think we'll give you the ability to contact us. Worst comes to worst, just reach out to rackspace.com and we'll get you. Or more importantly, you have great relationships with your Dell account teams, especially the Dell healthcare teams. We know how to get help. They can get a hold of us too. So.
Yeah, absolutely. Come join the fun. Come see us on the show floor. I'm in and out of in the booth and in customer meetings, and here until Thursday, right at the close of the show floor. If you don't find me, just ask anybody, hey, where's that bald head guy that was talking about Dell Alliance Healthcare Cloud? And they'll track me down. I got Sam's on speed dial. Hey, it's good. We'll make it happen. So, or
if you conversely, if you see a big guy with a bow tie wandering through the halls, I'm pretty easy to figure out. So,
You guys are very distinct. I like that. Well, thank you guys so much for taking time away from the booth. I'm sure it has been fun and exhausting and wonderful, as these things always are. And we really appreciate you taking a little time to come and talk to us today, for answering some audience questions. I know that we've all learned a ton, and it's really been a pleasure chatting with you both.
Thank you so much for having us and doing this. Thanks.
Yeah, it was a lot of fun. Thank you.
All right. Well, and while Sam and Michael have to get back to their booths and their talks and their meetings, we are going to keep the fun rolling here. We have a couple of questions for you. Now, I want to let you know that I am going to show the results in the next slide. So this is a really cool opportunity to get an idea of where your community is at. Now, to be clear, the results will not show any specific names, so don't worry that you're giving away any company information. What we're wondering is, are you currently using cloud cloud solutions for your healthcare organization's IT infrastructure. So take a second now and click on that poll, and let's get a little bit of a snapshot as to where the audience is, where this little microcosm of the healthcare organization, healthcare IT is at. All right, I'm going to click over to the results. So if you were hesitating or thinking it through, if you're mulling it over, last seconds to click on the poll there. All right, let's take a look and see where we're at. So it looks like we've got about 70% are saying yes, we are currently using cloud solutions. And there's about 29 or 30%. I don't know how the math works on that one. There's some 30% should be a nice even rounding that it's given us, are saying no. So that's interesting, and that kind of fits in with what we just heard, right? And I think as a lot more of organizations are moving over to the cloud, but now the question is, are you using them as effectively as you could? Are you getting the most out of your cloud environments? And that's of course what we were just chatting about. All right, let's go to our next poll. Are you currently considering or planning to migrate your healthcare organization's IT infrastructure to the cloud in the next year? So what we're looking for here is, are you thinking in a 12-month time frame or less, 12 weeks, maybe, who knows? So if you're not already in, are you thinking to migrate? Or let's say that maybe you are in, but you're thinking that you need to do a big upheaval. You need to do a big change. You need to reevaluate your cloud infrastructure. And so you'd like to spend more time looking at how your cloud infrastructure is working here. So yes, we are planning to migrate to the cloud in the next year. Yes, we are planning to kind of reconfigure our cloud environment. Or no, not on our radar, not planning to do it. Maybe you're planning to do it, but it's certainly not happening within the next year. And hey, applause to your self-awareness on that one. If you know your organization well enough to know, sure, but not happening in the next year. All right, well, I'm going to flip over to the results. So again, if you were hesitating and thinking it through, now's the time to click. Last chance. All right, so looking like here, we've got about 28% of you. Wow, the math is really fun on this. And then 71%, so it just keeps skipping 1%. Yes, we are considering or planning to migrate to the cloud in the next year. That's about 28% of you. And then according to the math here, 71%, let's say 72%, are saying, no, we are not considering or planning to migrate to the cloud in this next year. So interesting to see that. I'm guessing that of the folks, what we're kind of looking at is that Venn diagram of folks who are not there and don't intend to go there versus folks who are maybe already dipped a toe in and are thinking about diversifying the cloud. I bet that might be a slightly different skew between those numbers there. So that's interesting to see. I hope you all enjoyed getting that insight into your community. I always like to do a little bit of kind of getting an idea of where we sit in the broader spectrum, right? So if you answered yes or no to this, it might be interesting to see where your organization is sitting compared to the rest of the folks in the audience with us here today. All right, well, I'm going to throw up one more reminder here because I do think, especially if you enjoyed the chat today and you'd like to hear a little bit more, if you are at HIMSS, if you've taken time away or you're heading there tomorrow, please do make sure that you visit the Rackspace booth. That's booth 1225. They've got some cool swag for you. If you are not at HIMSS, send this information to a team member of yours who is. I'm sure a lot of you have someone on your team who is there. And what you want to make sure that they know about is this breakout session with Rackspace and Dell Technologies, Connecting Clouds, Rackspace Technology and Dell Technologies, Simplify Healthcare Solutions. That's Wednesday, April 19th, tomorrow. How are we already halfway through April? No idea, but here we are at 3:30. So make sure that if you are at HIMSS or if you know someone who is there, send them over to this breakout session because that will be such a good follow-up and in-person interaction with Sam, who obviously we just chatted with, and get a little bit more information about this because, we're barely scratching the surface. There's a lot more to dig into here. So I hope that some of you will be able to make it over to that session and to the booth. And I am going to go ahead and move along to, oh, look at that. It's time for a prize giveaway. So I will remind you one more time that you do need to be here live live and present at the webinar in order to win this $250 Amazon gift card, so shiny and new, waiting for you. And our winner today is Kurt Feilbaum from Alabama, or Kurt Philobaum from Alabama. That could be more right. Kurt from Alabama. Fella or Philobaum, you have won a $250 Amazon gift card. Even if I pronounced your name wrong, you still win. Congratulations to you, Kurt. As always, we will be in touch about claiming your prize after we wrap up today. And we will also be in touch with all those best question winners. So thank you to everyone who got those questions in. Before you leave, do make sure you click on that handouts tab one more time, open up that Rackspace page, and be sure you've got that tab open so you can do a little exploring after we wrap. Well, with that, on behalf of the Actual Tech Media team, I want to thank Rackspace and their special guest, Dell Technologies, for making this webinar possible. Giant thank you to both Sam and Michael for taking time out of their day at HIMSS. We all know how crazy those events are when you're running around and being on all the time at these booths. So to be able to kind of step back and have an in-depth conversation with all of that going on in their heads is very impressive, and we very much appreciate that. I see Prasad sending a high five and a thank you on back. And Prasad, that's a great segue, because my next thought is to thank all of you out there in the audience. Those of you who asked questions, who clicked on the poll, who clicked on a handout, really bringing the engagement up by interacting with our webinar today, but also just all of you for taking time out of your day and spending time with us. I know how busy life is, even when we're not at conferences in person, and it's really nice to take a little time for these in-depth discussions to really share some of our information, our experiences, things that we've learned and seen, and really pool that information and engage in these discussions together. Cheryl and Nick, I'm seeing some thank yous from you as well. I love that. All the high fives, all the smiles. What a great afternoon. Thank you so much for joining us here today. I know that I have learned a ton. I hope that you all have as well. I can't wait to see you all at a webinar, a megacast, an ecocast, a summit. In fact, come back and join us on the 26th if you enjoyed this webinar. Rackspace has another webinar with us on April 26th. That is at 12 p.m. Eastern, 9 a.m. Pacific, and we are going to be chatting about connecting clouds, simplifying solutions for seamless SAP solutions. You got to love that. So join us for that webinar on how Rackspace and VMware are simplifying solutions, connecting clouds. This is going to be such an interesting conversation, so please do come join us. Again, that was April 26th. Mark your calendars. So we'll see you again for that one, and until then, I hope you have an absolutely beautiful end to your day.